This portion is brought to you by Mercury Drug. Nakasisiguro, gamot ay laging bago.
Good morning mga kabarkada! Ako po ang inyong resident doctor, Cecil Katapang. At ito ang mas pinalakas na Generation RX, kung saan siksik ang impormasyon na magiging gabay nyo tungo sa tamang kalusugan. Ngayong umaga, samahan niyo po kami as we celebrate our very special episode on World AIDS Day.
Well, the immune system is basically your defense against infection. So if you have a low immune system, you can actually be susceptible to any kind of infection. HIV and AIDS are not the same, no? HIV is short for human immunodeficiency virus. It's the one that causes AIDS. Basically, AIDS is or acquired immune deficiency syndrome is an end stage of an HIV infection. So it doesn't mean that if you have HIV or you're positive for HIV, you have AIDS already. Well, there are no local studies about it, but they saw in the 80s yung natural progression of HIV. They found out that if you don't get treatment, it usually takes around 10 years of infection with HIV to eventually have acquired immune deficiency syndrome or AIDS. What I want to point out, actually, if you check our National Epidemiology Center statistics, the largest number of patients who tested positive, if you check our statistics, are the ones who don't have symptoms. And the only way that you can find out if you have HIV is to actually get a test. If you have HIV, you have a low immune system. And if you have a low immune system, you can actually get a lot of infections like pneumonia, like tuberculosis, and like skin infections and other infections for that matter. There are two ways of knowing if you have AIDS. We check the CD4 count of a person. Yung CD4 are cells that are attacked by the HIV. They're also part of your immune system. If your CD4 count falls below 200, then you're considered to have AIDS. There are also what we call AIDS-defining illness, no? That usually those infections, when it hits a person with normal immune system, they don't get easily affected. But if you have a low immune system, then it manifests as an infection, no? That's what you call the AIDS-defining illness. So there are different ways of transmitting HIV or getting HIV infection. The most common would still be unprotected sexual intercourse. So you can get HIV through blood transfusion or being infected with other blood products. If the mother has HIV, then she can actually pass it on to the baby. Ways to prevent HIV. No, it's A, B, C, D. As easy as A, B, C, D. A for abstinence. No? B, be faithful. C, if you can't be faithful and you cannot abstain, then use a condom. And also that involves proper way of using a condom. D, don't do drugs. No, recreational drugs, because when you do drugs, you actually do stupid things, like not wear a condom. And E, I think that's, what we're doing right now is to educate people about this disease and be aware of how you can actually get it and how to prevent it. Having HIV is actually not a life ender, no? But it's a wake-up call for you to take care of yourself better. And if you're a mother who feel that you have a risk for HIV, get yourself tested. There's actually help and the medications are for free. I'd like to take this opportunity to invite you to Makati Medical Center for World AIDS Day. We actually have certain activities on December 2. Admission is free, and we would actually like for you to come and be educated also.
Ang ating tag photo for today ay ang tamang paggamit ng public toilet. Dahil nga public yan, maraming gumagamit niyan. Hindi lamang ikaw. So, pag gagamit ka ng public toilet, huwag tungtungan ng inidoro. Marumi ang iyong sapatos. I-flush ng maigi ang iyong dumi o ihi at huwag mag-iwan ng souvenir para sa susunod na gagamit. Salamat kay Mr. and Mrs. Usman of Everything About Santa dito sa Marikina. To Ever Bilena for my makeup. Sana po ay marami kayong natutunan ngayong Sabado ng umaga na magiging gabay nyo tungo sa tamang kalusugan. Kami pa rin po ang inyong kabarkada dito sa Generation RX. Tandaan, live healthy and travel light.